Hi, this is Dina Shepard, the owner and executive consultant with Altera Consulting. I am a nurse entrepreneur and a serial entrepreneur. I have owned a couple of senior care businesses and other businesses as well. And I wanted to do this informational webinar for you all today to discuss geriatric care management and just give a very brief introduction and overview to care management and how this can be utilized as a business. So that is the purpose of this webinar for today. It's just a brief overview. If you have any questions at the end of the webinar, I will be available to answer any questions that you may have, and I will make sure to post a link. I know a lot of you got this information through my post on Facebook, so make sure you are following me on Facebook and you can schedule time to talk with me. I do offer free discovery sessions. They're about 15 minutes long. You can request that time, or if you have just a brief quick question, you're more than welcome to reach out to me and ask those questions as well. So we're going to go ahead and get into the session here. So again, I am Dina Shepard with Altera Consulting, and we're going to be discussing geriatric care management. So the first thing we're going to talk about is what is care management. It's good to have a clear idea and to clear up any misconceptions as to what care management is. So to plainly state, care management is the process of planning and coordinating care of individuals with physical and or mental impairments to help them meet their long-term care needs, improve their quality of life, and maintain their independence and safety. So the goal of care management genuinely is just to keep the individual safe. And with the focus on today's topic being geriatric care management, the goal with geriatric care management is to keep the senior safe in their home setting. Home setting can be anything from their own private home to an independent living community to an assisted living community and so forth. So wherever they're calling home, the goal of the care manager is to come in and be a support and an advocate for not only the client, but the family and any other active caregivers that are involved in this particular client's care. So you typically see individuals that receive the services. You do have care management programs for children, and then you typically see adults and seniors. Usually care management services that are provided to children are usually on a bigger, more commercial corporate end. So you'll see hospitals that have care management services for children and things of that nature. But it's not completely out of the realm to see independent care management companies, smaller care management companies, offer pediatric care management. So that is definitely a niche to look into if that's something you are interested in. But typically when you are thinking of care management, it is usually adults and seniors that are common clients for care management. So care management focuses on the disease processes of the individual, but it also takes a holistic approach to well-being. So when we say a holistic approach as well, when you are working with your clients, before you even start determining how you'll be working together, you will do an assessment and you're going to see what their needs are, whether there are financial needs, needs for food, needs to help pay their bills. So a holistic approach means you're going to look at the complete big picture. You're not in just to help exclusively for healthcare issues, but you're there as an advocate, support, and resource for all areas that they need support. So what does a care manager do? A care manager, as I mentioned just a moment ago, the care management process starts with assessments. very similar to the nursing process for those that are nurses. Before we can get in and start taking care of anyone or providing services or a resource to anyone, the first thing we need to do is to provide an assessment. So the assessment process needs to be very inclusive. It needs to involve all aspects of this individual client's life. So we need to know what's going on physically, mentally, emotionally, spiritually, financially. We need to know of any kind of medical diagnosis they have, what kind of medications they on, are they compliant with their medications, are they on a special diet, are they compliant with that diet, everything, including asking those questions. You also want to pay attention to your surroundings. So typically, best practices, if you are going to be providing face-to-face care management services, when you go to the home, you want to see what the entire home looks like. You want to know, did you nearly fall when you were walking up steps? That can be an issue. Are there several steps and now the client is utilizing a wheelchair? Was the home clean? Was there infestation of bugs in the home? All of these things that are not necessarily, they don't go hand in hand with medical, but then to a degree they do. You want to make sure your client is in a clean, safe, and healthy environment. So those are all the things that you're going to do during the assessment process. And usually during the assessment process, it's best practice to let your clients know that that's usually going to be one of your longest visits is during that time, because you really want to ensure you're painting and developing the clearest representation of what's going on in that client's life. So once you have completed the assessment portion of the care management roles, then you're going to go into care plans. You're going to create a care plan. So care plans are typically created based on what you are finding in the assessments, and they're created based on urgency. Then you're going to do your care coordination, teach self-management, educating the families and the client as well. But I want to really focus on, educating the families, because sometimes we forget that even though we're providing care for one client, the family, especially if they're involved, they're your customers too, and you want to educate them as well. And then you have the options of providing telephonic care management as well. So those are all the different things that care managers do, and this is by no means an inclusive list of everything that a care manager does, but just to kind of hit the main points, this is in general what a care manager will do. So the importance of assessment, I did kind of touch on these points already, but again, we'll go over it again. The assessment process is extremely important in care management, and it needs to happen before you provide any care, education, and support to your client. The needs assessment needs to be completed. And your assessment tool, as I mentioned previously as well, needs to be comprehensive and cover all areas of the client's well-being. So that's included but not limited to the physical, psychosocial, financial, medications, medical conditions, and just any other pertinent histories. That all needs to be included in the assessment process. So when you are thinking about your assessment tool that you'll create, or programs that you will create and customize to your business, you want to keep in mind the assessment component and how you can utilize that to really offer maximum services to your clients. Care planning. So once the assessment has been completed, the next step is to care plan. So that's going to be based on the results of the assessment, and care plans should be categorized based on importance. You want the care planning process to be an inclusive process. And you're going to hear me say inclusive often when we're talking about care management, but you want it to be an inclusive process. So the client and any involved support needs to be involved. So that needs to be the family members, any professional or family caregivers, any active medical or healthcare providers, such as if they have home health care in place, if they're on hospice, and also their primary care physicians as well. These all need to be individuals that are involved in the care planning process. And even if they are not available to meet, them being involved in the care planning process is just simply them being notified that you are now a care manager, you're involved in their care, and how can you work together to make sure you develop the safest environment for your client. So care plans will be changed on as the needs of the client change. Um, when you're starting a business as a care manager or care management firm, you need to be clear on your care planning processes. So you need to be comfortable and know how to create effective care plans, how to navigate through those care plans, and how to drive those care plan meetings with the family, with the client, and anyone else that may be involved in this individual's care. And you also need to know when care plans may not be working out, when they're unrealistic, and how to modify those and make those attainable and realistic as well. So knowing how to do an assessment, knowing how to care plan are very, very critical parts of being a care manager and having a care management firm as well. Care coordination. So once you have completed care planning, you've completed the assessment process, now it's time for you to coordinate the care based on the findings that you discovered during the assessment process and based on the care plans that you have developed. So care coordination is extremely important. It's very important in the role, and it's going to be a constant activity. You're always going to be coordinating care on some level. So care coordination includes, but is not limited to, providing clients with community resources, coordinating care and wellness needs, such as making referrals for additional providers. So that could be home care, home health, hospice, physical therapy, whatever the needs may be. Coordinating DME, durable medical equipment. Maybe you notice that they have a need. There's issues with balance. Maybe they desire a cane or a walker, whatever the case may be. Making those coordinations and setting that up to make it easier for your client to receive the resources that they need is very important. When we're touching on community resources, again, this can be anything. This could be Meals on Wheels for your client. Maybe they need assistance with LIHEAP for the winter time. And for those that do not know what that is, that's a low income energy program for usually seniors and those that meet financial requirements. It gives them an opportunity to get their heating sources at a reduced rate, and there are some programs that may even be free. They may have some form of sponsorship there. It depends on your state and it depends on the company. But those are community resources that you will be gathering based on the needs of your clients. So it's very important, if you are looking to work independently as a care manager yourself, or set up a care management business and hire individuals to provide this service, you as the business owner, you need to start thinking about resources that you can connect with, people in the community that service your population that you are care managing, and you need to really connect. So constant networking and constant community engagement and staying abreast of what's going on and what resources are available is going to be very important, because that's going to be something that your business is going to rely on, because your clients and their families are going to rely on that as well. Another area of care coordination is to coordinate appointments, especially doctor's appointments. One of the best ways for individuals to be successful with staying home and not going back into the hospital setting is to make sure that they're compliant with their doctor appointments and they're compliant with their care, that their primary care physician and any other physicians that are involved in their care, that they're compliant with those measures of care. So that's an area of constant support, constant coordination that you would be doing as a care manager or a care management firm. So coordinated communication amongst clients providers to help all be informed of the client's status and care. That's another very important aspect of care coordination, and I touched on that previously on another slide, but just being very open, making sure that all those that need to be involved in this individual's care is involved. Too many times you will see a client may have home health, and the home health providers may have their own prescribing physicians and their own physicians that they communicate with. And then the client also has a primary care physician or a geriatric specialist, and that geriatric specialist may not even know that home health what's going on with home health. You know, maybe they wrote the order for home health, but they didn't get any kind of continuous feedback as to the status of the client. So you coming in as a care manager or a care management business can make sure you're bridging all of those gaps. That's going to be very important to bridge the gaps, make sure the communication is happening to all the key players and everybody's on the same page. And if there's a change, you can be that person to facilitate the change. So you're truly an advocate and a liaison in this role. So if that fits your desires and your professional goals, then care management is definitely an area to look into. Client education. In healthcare, you're always doing teaching. You're always teaching. So care managers are one of the primary sources of client education. As you develop that relationship with your clients, you're going to be that go-to person for them and for their families, and they're going to expect you to be able to answer their questions and educate them on the things that they need to be educated on. So education can come in the forms of resources that you provide them, verbal communication, hands-on skill demonstrations, instructions, whatever the needs may be. And when we're talking about hands-on skill demonstrations, we're not talking about anything extensive, but just, you know, simple things that maybe they need to modify certain setups in their home, or maybe they need to learn how to properly use a pill organizer container and they're having issues with that. Those are areas where you as a care manager can come in and provide assistance and training and oversight in those areas. So education is not just limited to the client, but the families and others involved in the client's care as well. And as I said previously, education is a continuous task in care management. It is important to stay on top of healthcare changes in the community, especially those that pertain to your clientele population. So now we have telephonic care management, and that is a alternative to field care management. One of the benefits to telephonic care management is the opportunity to cast a wider net when it comes down to services that you can provide. There are times you can cross state lines when you're doing telephonic care management. So that is one of the attractive features to telephonic care management. So telephonic care management, simply put, it consists of providing care management services through a telephone or other virtual platforms. The same care management cycle must take place: assessment, care planning, care coordination, monitoring, and evaluation. So none of that changes when you're doing telephonic care management. It is all the same. Your care assessments can be completed telephonically, Or you can hire an individual to perform the face-to-face assessment and submit the results to you. That is all dependent on you and how you want to set up your business. And again, as I previously mentioned, telephonic care management can be performed across the U.S., which provides a wider range of clients. So telephonic care management is absolutely an option to look into. It is something that is becoming even more popular as we're looking at the increase of telehealth, telenursing, telemedicine programs coming up. Telephonic care management is right in there with the mix. So usually with telephonic care management, you see companies that offer the services, and they usually have a larger population of clients since it is telephonic. But you as a business owner, you will be able to determine, how many clients you want to see, or how many clients you would want your staff to have on caseload at a time. But telephonic care management is absolutely something that you can incorporate with traditional field care management services as well. So who can be a care manager? Um, As far as the practicing role of care manager, most care managers are nurses, social workers, or individuals with some form of healthcare administration experience. Maybe someone that has worked in senior living or long-term care in some form of leadership um, area. That is typically who you will see as a care manager. Certification is available for care managers, but it's not required to practice as a care manager. So the main focus is experience, and honestly, the excellent assessment skills are going to be your strong suit. So the ability to assess, the ability to receive resources, think outside of the box, those are going to be all strong points for a care manager. So certification is definitely attractive. It provides some credibility to you for individuals that do research on care managers and what they provide. Definitely having proper certification, because there are some companies that will offer some form of certification and it's not even worth the paper it's printed on. So there are about one or two companies I know off the top of my head that do offer legit certifications, and they also provide resources to those that are in private practice as well to help you grow your business and help you stay abreast of the changes that are happening in care management as well. So those are benefits of certification. Just kind of extra cushion as far as credibility is considered, and also just the ability to have a network of fellow care managers and stay abreast of the changes as well. So that's what certification provides, but it is not required. There are no state regulations for care management at this time. And when I say state regulations, I mean how home health is regulated by the state and other disciplines are regulated by the state. Care management is governed by best practices. And again, to get more clarification on that, you can look at the providers that offer certification for care managers, and they provide a wide range of their industry's best practices as well. So if that's something you're interested in, please reach out to me and let me know, and I can get you the names to those providers that do certifications for care managers. As far as owning a care management business, I want to make sure I clarify this because a lot of people don't realize this. They feel, well, I don't have, care management experience myself, or I don't think I have enough care management experience. You do not have to, if you're setting this up as a business to build your own organic business, you do not have to be the one out there providing the care. There are plenty of healthcare companies that are not owned by a clinician or someone with any kind of healthcare experience. So if it's a matter of, you know business and you want to get into this field, reach out to me. Let's talk about how, you can develop this and receive the support and the consulting, the training that you need to make sure you are running a sound business. But don't let the fact that maybe you've never worked as a care manager prevent you if you are looking to start a business and get into this area. Even if you are a healthcare provider and you just never worked in the role of care manager, you don't realize how many transferable skills that you have that you can utilize in business. So if you have any questions or doubts about whether this is for you simply because of your experience or lack thereof, definitely reach out to me and let me know, and we can discuss this further. I'd be more than happy to do that for you. So how to start a care management business. When you're looking to start any business, the first thing you want to do is determine what your ideal client will be, and you need to create a business plan. And when I say create a business plan, this does not have to be something extremely formal. You don't have to pay anyone to create a business plan for you, but it's always best to put pen to paper and kind of map out what your goals are and categorize them. Your immediate goals, your goals for the next 3 months, 6 months, year, who you would like to serve, where you would like to see your business go over the next 1 to 5 years, 7 years, 10 years, whatever the case may be. You just want to plan. And during that planning process, you're going to want to think about, rates and services and programs, and see what the competition looks like as well. Those are all very important things. And see if what you're wanting to do is even a feasible plan for you. So that's the importance of a business plan. That's where, when I say business plan, that is what I am talking about. Just really creating something that will be a guideline. It's going to be a modifiable guideline because things will change, but just a guideline for business sake. You want to create a plan. Then, of course, you want to establish a business entity you can incorporate. Some people may desire to be a sole proprietor, some an LLC, an Inc., an S Corp, whatever you decide. Again, that is something that you would want to speak to a CPA if you want exacts on the differences benefit-wise and legal-wise. For the different incorporations. Traditionally, you see a lot of healthcare companies use an LLC, and when I had my geriatric care management business, I did have an LLC as well. So if you kind of have an idea as to how you want to incorporate your business, you can do that through your Secretary of State website on your whatever state you live in. And then you would just establish your business and go through the channels that are required to get business going. You would obtain proper insurances, usually a liability insurance, and an errors and omission insurance would be the key to insurances that you would look at purchasing for coverage for your care management business. Then you want to create a comprehensive assessment tool that's going to be the hub of your business. That assessment tool and how detailed it is and what does it provide. And then you want to market your business. You want to market your business to, wherever you're going to find your ideal clients. So marketing is going to be continuous and ongoing. Marketing is not something that you can do occasionally. You have to be committed to the marketing process in order for you to get clients, in order for you to get those resources to help coordinate care. So marketing needs to be a primary focus in your business. You must market. If you're not marketing, you're not getting clients, and ultimately you're not making money and you're not in business. It is now just a hobby. So marketing is very important, and it needs to be taken seriously, and it needs to be strategic as well. And then you're going to service your clients. As you're getting your clients in, you want to make sure that you're providing excellent service, you're meeting their needs, you're setting standards, for your business. You can't, allow the clients to run the business and dictate how you do things, but you want to be clear on the services you provide. Don't stretch yourself thin. A lot of times you want to do everything and provide every service. Stick, especially in the beginning of business, stick with a couple things that you can do strong, and really finesse those things and develop those things and offer it at 125% effort. And then as you grow and get more experience as a business owner, you can then look at adding different services and different programs to your care management business. But don't think you have to provide the kitchen sink when it comes down to care management. Just offer the things that you're strong in right now. Develop programs based around those to service your clients, and then expand as time goes on. So who can care management firms work with? So you have your individual clients, your direct referrals. So if you have a website and you're marketing, you may have individuals just directly contact you and say, I'm interested in your services. That is definitely an option. Elder care, geriatric care management. Again, this webinar is focused kind of on geriatric care management. These tips can certainly be used for middle-aged adult and young adult, and if you want to look into pediatrics, you can certainly use these tips for that, but the focus here is elder care. So going to places like a nursing home, that is an option. Assisted living is a big area. Independent living are big areas. Senior centers may be options for individuals that are fairly independent and just need some care. Maybe they just, need a extra pair of eyes to help them navigate through life. So that's where you can come in as a care manager. Elder law attorneys are wonderful to partner with, and a lot of elder law attorneys are hiring care managers to work for their firm. But if you find smaller elder law attorneys or just elder law attorneys that do not have care managers, this is a great opportunity to develop a partnership where you can provide care management services. Elder law attorneys are going to be the individuals that handle all kinds of legal situations for seniors, for their families. If you're looking to work with wards of the state, elder law attorneys are the ones that are usually granted guardianship, or they are the conservators. That's what it is. Conservators for different states is what they also refer to as a guardian. So those are individuals that have wards of the state, and they need individuals to go out and do care management, follow up with these people. Attorneys are extremely busy. They are not they're not clinical. They don't know, those certain things, but they do have a responsibility to make sure that whoever they are guardian over, they are taken care of. There's a reason why they're guardians. So they have to make sure that they are fulfilling that role. And so many times you will see attorneys partner with care managers, because then it gives them an opportunity to know that their individual, their client that they are ward over is being well taken care of. So elder law attorneys are wonderful, wonderful, wonderful to partner with. You have workers' compensation. There are some attorneys that handle worker compensation cases, and some independent firms that may hire care managers as well to help oversee workers' compensation cases. So that's an option. Small medical practices as well are great options. So primary care physicians that have a large senior population, internal medicine, geriatric specialists, those that all see seniors on a regular basis. And I say small because usually they do not have a care manager on service. So a smaller company, and I mean, definitely look at all your resources, but a smaller company is probably going to be a little bit more successful for you to partner with and to provide care management services. And with the laws changing with Medicare, um, and how physicians are concerned about reimbursement and making sure their clients are healthier and not running back and forth to the hospital, it would definitely be advantageous enough for them to provide a care manager through their services. So then you also have probate attorneys. They are a great resource to partner with as well when they're handling estates. They may have a client themselves that, maybe the spouse has died, the family is out of state, or whatever the case may be. So that is definitely a referral opportunity for you as well. And then you have Medicaid programs, and that's based individually on the state. So some states offer programs for private firms like care managers to get contract work for their Medicaid providers. So you would have to find out what your states offer and find out what the sign up process would be for those programs. So the earning potential for care management firms are typically invoice their clients on a monthly basis, and they usually charge per hour for their services. So care management services range anywhere from $50 an hour to $200 per hour plus. It depends on your geographic area that you live in and the services that you're providing. Assessments and other customized packages can be billed at a flat rate ranging anywhere from $200 to $1,000 per package. So there's definitely areas for creativity and definitely areas to make money and have revenue coming in based on the services and the products that you provide as a care manager. There are so many things that you can do as a care manager to be of service, provide value, and then also bring in revenue. And that's what it's all about as a business owner. Care management services are typically not covered by Medicare and Medicaid, and very few long-term care insurances cover care management expenses. So care management is typically going to be a private pay service. As I did mention on the previous slide, there are certain Medicaid programs based on your state that will contract out, but traditionally, like enrolling to become a Medicaid provider and receiving reimbursement just on a standard level like that, that is typically not seen with care management. So there are certain programs, very few long-term care insurances, but typically you're going to see this is going to be a private pay service. And again, a lot of people hear private pay and they panic, oh, I'm not going to be able. There are plenty of people that are willing to pay for private care and private pay services if the services are worth the pay. Develop a quality program and the private pay clients will come to you. This is an industry where we're sometimes limited and restricted by insurance, and people feel overwhelmed and they think that, no one has the money or the resources for private pay, but that couldn't be further from the truth. It is more so about you, the business owner. What are you providing? What is making you different? How are you providing it? Even if a lot of your services parallel and mimic what other companies are doing, because there's necessarily no reason to totally reinvent the wheel, but what are you as a business doing to say, I'm going to charge you $150 per hour for my services? Is it worth $150 an hour? Would you pay $150 an hour for your services? That's a great way to look at it. For your mom, if you were looking to have a care manager for your mom, when you're developing your programs, keep that in mind. How would I want my mom to be taken care of? What services for care management would I like to have available for my mom or my dad? And keep in mind private pay. What would I be okay paying for these services? So don't ever feel guilty for charging for private pay. Don't ever feel like you won't be able to get any private pay clients, because that is definitely not the truth. You absolutely can get private pay. You just have to be strategic. So how to get started? So developing a care management business, it requires planning, marketing strategy, and experience. And when I say experience, just some kind of experience in business and healthcare. And even if you don't have those firm foundations in regards to experience, you can always work with someone that can help you. We have developed a 30-day training program for those that are interested in starting their own care management firm and obtaining their own clients. So, as some of you may have been following me for a while now, I did introduce the concept of partnering with certain insurance companies, but this is not that opportunity. This is for people that are interested in organically growing their own care management companies and getting their own clients and being responsible for their own business. So you're not subcontracting from another care management provider. This would be you owning your own business. So it's a 30-day program where we go over um, all the general business needs you have. We work together on ideas on how you can customize your business and make it specific to you and to the clientele. We work closely in that manner as well. This is a one-on-one training for you. So this is not going to be something that is group. It's individualized, because each person is going to want to offer something different. And I also want to respect the confidentiality, as people are in their beginning stages of business. They may not be comfortable sharing their business ideas in a group setting. So it is a one-on-one training opportunity. It is where we work together, and we are making this, or developing this system where it will be a self-study option as well, and that will be coming out around January of 2018. But for now, if you were interested in working one-on-one with myself in creating your business for care management, this is absolutely available to you. We go over marketing, we go over how to market. Again, very important on how to market and how to deal with your clients, and what to do to get out there in the community for people to get to know who you are. So part of the tuition includes a modifiable comprehensive assessment tool, care management, business startup consulting, marketing and branding strategies, and customizing your program. So just customizing your services. So the assessment tool, it's modifiable for you to add, take away. It is several pages long. It's about 15 pages in length, and it's very simple and easy to utilize. It is a paper tool. It is not in software form. It is paper tool, but it is definitely something to get you started if you are looking to start this business on a budget. That is my focus when I work with my clients on starting business. What can we do to get you started business early? We can always move into software later and things later, but what can we do to get you organized and starting business on a budget? Because that's just the real world and the reality of it. And that's how I started my business. So I will definitely have a post where you can comment if you are interested in learning more about this 30-day one-on-one consulting program that I am offering for individuals that are looking to become care managers and that are interested in really starting a business and doing this either as a care management firm or learning how to contract themselves out to be care managers as well. So this is just a little history about Altera Consulting and about myself. As I shared earlier, I am an LPN. I've been a nurse for 16 years. I've worked in geriatrics my entire career, except for 2 years that I did occupational nursing for Lockheed Martin on a contract. But the majority of my experience has been in senior care. I've worked in senior living leadership as a director of resident care and executive director for a few companies: Atria Senior Living, Emeritus Senior Living before it became Brookdale, and Belmont Senior Living are just a few of the companies that I've worked for throughout my time as an employee. So I did some consulting for successful assisted living communities and non-medical home cares. Those companies are still running and they're very profitable and doing well. One gentleman actually was able to sell his company and make very well from it. And those are very exciting and encouraging things to see when your clients are able to show longevity, or if they decide to have an exit plan and sell their business to create something new, they're able to have revenue and have a profitable business to do that. So I've been honored to help those individuals as well. And just myself, I've owned businesses, janitorial service, recruiting firm, and non-medical home care and geriatric care management business as well. And I sold my home care and geriatric care management firm and took some time. I took a little sabbatical and decided to come back and consult full time. So that is what I'm doing. I'm very passionate about helping entrepreneurs such as yourself, and just want to see you all be very successful. So that's the end of this information session in this program. Again, if you are interested in learning how you can sign up for the Care Management 101 30-day program, please feel free to contact me. You can reach me again on Facebook, www.facebook.com/healthcare CEO success. You can find me online at www.alteraconsult.com. I can be reached via email as well at dshepard@alteraconsult.com, and Shepherd is spelled SHEPHERD. And I can be reached by telephone at area code 678-749-1874. So I hope you all have enjoyed this, and I hope you all have a wonderful rest of the year and make awesome plans for 2018. Thank you.